should you be worrying about the clicking or popping in your back causing severe pain and damaging your back? I'm going to answer that in a few minutes. Welcome. This channel is not about quick fixes. In NxHLife, we're all about helping pain warriors to find clarity about their pain, not chaos. And I'm Antony, physiotherapist, nutritionist, and functional medicine practitioner. I help people understand the unique pain story as a pain story consultant. And in this channel, we're trying our best to translate the latest science into empowerment so you can take back control of your pain and your life, live the life you want again. So, if a click or pop cause severe back pain, did you damage anything? It's very real that when one thing happened at the same time as a result of severe pain, you might think that this is actually causing the pain, but in reality, not usually the case. Let me tell you a story. I've seen a couple clients that comes in with a click or pop that so painful that he said they need to fall into the ground straight away, and they can't even get up. They're not aged client as well. Some of them are really young, and they reported the pain is so severe that they want to call ambulance to get them to hospital. And that is very logical to think of, that click or pop is causing the pain. And usually what I do is ask them a really simple question, that whether the click or pop has a really loud kind of sound, or is it more like a little grunting or movement? Because usually click or pop, it's really loud. It's what we call a cavitation, which is like a technique what chiro does, releasing and adjusting joints. And it doesn't damage your joint. But if your back happens to be really sensitive and sore already, like an ongoing chronic lower back pain, a click or a pop can actually aggravate and trigger the symptoms and make it worse. But it's not damaging the joints. That makes sense. So usually these clients will come in with a really stiff back and they're really afraid of bending. And that's very normal, because what happens with a click and pop, or maybe it was a bend and caused a painful experience, actually remember in your body and your nervous system. So you become protective of what's going on. And sometimes it's not just understanding what's going on, but you need some practical strategies to help you retrain the body again. If you're done guessing and want to start understanding your pain, subscribe and join the Pain Warrior movement. We're here together, help you understand your unique pain story. Right, let's go into the practical step. So the first step is about understanding what's going on. So if it is a cavitation, it is not damaging the tissue, it just happens to be really sensitive tissue that is triggered. What we need to do is also slowly retrain the nervous system in one way, where we gradually expose to some normal movement with some tactics, because usually the client that came in with this painful experience, they will have complete avoidance of bending. So what we'll do is start with some breathing patterns to help us sit down and get up easier. During sit down and get up, we're already bending our back a little bit. Usually it'll come in really stiff and try to sit down very slowly, getting up very slowly, which actually can put more pressure and soreness into the back. So what we do is we use breathing, the diaphragm, to help us control the core even better. Breathing in and getting up with using our glutes muscle, and breathing out and relaxing all the way down into the seat. That will be a good first step to practice. And then the second step will be practicing breathing in to stand up tall and breathing out to slowly bend down, a tiny bit at a time. As you practice it slowly and the back becomes less sensitive, you'll be able to bend better. However, there will be more to that, as we explained in the last chapter, that there are 3 lenses to your pain. And some people with chronic low back pain will also have the systematic sensitivity going on. That's why the low back pain is not going away. So we'll need to explore that further as well, which we'll do in the future lesson. Remember, you are not broken. Protection does not mean damage. It is just telling you that there is a danger signal. As soon as we understand it, we'll be on our way to recovery. You don't need more treatment. What you need is to start understanding your pain. And that's why I created 7 Unspoken Truths about chronic pain. Helps us not just to understand our body, but the system behind chronic pain. So then we have a full picture of what we're dealing with, what we can use as advantage, and what we need to explore more. I'll see you inside. See you in the next episode.